Hi, I am Jonathan Colopy, an executive director with the Y of San Diego County, and this is the Y's Be Well podcast. Today, I'm fortunate to have our guest, Dr. Benjamin Maxwell. Dr. Maxwell is the Division Chief of Child and Adolescent Psychiatry and the Una Davis Family Chair in Behavioral Health at Rady Children's Hospital. We're so fortunate to have Dr. Maxwell not only in the house here, but also in San Diego, providing the array of services that he does. So Dr. Maxwell, thank you for being with us.
Oh, thanks for having me, Jonathan. This is fun. Happy to be here.
So I recognize that back in the end of 2021, the Surgeon General provided a health advisory regarding this emerging youth mental health crisis, and thus for all of us, a call to action in terms of looking at what we can do to make a difference in this space. So to me, what I came away with more than ever, the whole idea that it takes a village holds true as we talk about addressing youth mental health. And as you and I have talked a little bit about, you're involved in a number of collaborations through Rady Children's Hospital and beyond to bring through meaningful improvements in mental health. So I just open up to wherever you want to go in terms of sharing what you're doing currently.
Yeah, no, I mean, we're really excited that the Surgeon General of all people is really doing a wonderful job of bringing attention to the issue. It's something that we've seen here at Rady Children's Hospital over the past almost decade now. So over that period of time, we've seen more and more kids coming to our emergency room in psychiatric crisis, needing some sort of psychiatric care, and really hadn't been able to find it before coming into our emergency room. So at Rady Children's, we've been really involved in trying to find ways to get kids access to care as early as possible. And that goes back really to about 2015. So we've looked at improving our ability to respond to psychiatric crises through things like the behavioral health urgent care in Mid-City. That's a Price Philanthropies Foundation supported effort. Our Copley Psychiatric Emergency Department really looking at providing that safety net for kids and families that are in psychiatric crisis. And that's sort of where we started. And then as we started doing that, we started asking these questions about, well, how do we prevent kids and families from getting to this place in the first place?
Excellent.
And so we've started to do a lot of collaboration with primary care pediatrics throughout the community, both here in San Diego and in Riverside County, where we actually embed mental health therapists into those primary care clinics, these trusted primary care pediatricians, the same people that you take your baby to and then your toddler to, and you establish that relationship with. We're trying to bring mental health expertise there because a lot of times those pediatricians can identify early problems and we can find solutions early on. So we change the trajectory of kids' lives and they don't end up needing these emergent services. So, from a healthcare standpoint, we've really been focused over about the past decade of trying to figure out how you provide access to care, early intervention, identifying these things as well as possible and getting the right type of care to in the right place in the right time, sort of thing.
Well, I appreciate the focus on access as you spoke to that, because everything that I seem to see speaks to the lack of clinicians to be able to meet the particular need. So obviously needing to go about providing impact and care in a different way. So pediatricians makes a lot of sense.
Yeah, no, I mean, we have to do something to expand the number of people that are working on this. And that was one of the ideas. So as part of that project, we've trained over 200 pediatricians in San Diego County in dealing with mild to moderate mental health concerns for their kids. So it's not these severe, really complicated situations that we're asking them to get involved with. It's really just sort of basic mental health care that they could get involved with. And unfortunately, our medical education system in previous generations hasn't really done a good job of training folks on that. So we're trying to change that so that really any door you come into at Rady Children's Hospital, you're going to have somebody that's trained in it from a mental health perspective.
Well, the whole idea of being able to intervene earlier, recognize some of the concerns, may head off the more significant psychiatric or mental health issues.
Yeah, absolutely. I mean, that's the whole intention here. And so if we can do that, and if we can prevent some kids from having these other things, then it opens up access to care and what's right now an overburdened system of care. So how can we sort of prevent kids from needing it? And then that opens up these clinics that right now have really long wait lists.
Dr. Maxwell, is this something that can be scaled, beyond San Diego in terms of even going back into medical school, family practitioners where there is a greater emphasis on mental health?
Yeah, absolutely. And that's, we were talking before we got started about one of my mentors, and one of my mentors in one of the lunches that I do with him on a monthly basis, he said, the thing you have to figure out is how you scale this. And I think that's really the question is, so we're trying to attack it from all these angles of medical schools. How do we get involved with medical schools such that the curriculum has some of the things in there that these to-be doctors are going to need? We partner with the pediatrics residency program here so that some of the pediatricians coming through get this sort of training as well. We're doing continued medical education with pediatricians, nurses, other members of Rady Children's Hospital. And to the question of scaling, yeah, we think not only can it be standard of care here in San Diego County, certainly could be standard of care in the state of California, both things that we're advocating for, and really serving as a model for the entire country to suggest, hey, this is the way that you develop a system of care for getting kids access, appropriate access to care, that we could have that here in San Diego. And it's all because we've had this ability to collaborate and do interesting cutting edge things.
I'm aware from afar just the challenges in healthcare for clinicians to have the time and resource to really address patient needs. Often I hear about, a visit with a doctor, there's only a few minutes that they have.
Yep.
And so I'm wondering how you're seeing this meet or work in practice, that you're empowering them with the information. Do they have the capacity and time to attend to these issues?
Well, one of the things that we found really early on when we were planning this, we had these planning committees where we'd come together over lunch. There'd be about 15, 20 people on this original planning committee on the mental health integration program. A few of those people were pediatricians, and we started talking about this. And they said, guys, this all sounds great, but I have on average 7 minutes per patient. And the conversations that you're talking about having, we just don't have time for. And so that's why we really started thinking about the idea of embedding a master's level therapist. These are either licensed clinical social workers or marriage and family therapists, embedding them right in that pediatrician's clinic. Their office is 20 feet away from the pediatrician where he's given vaccines and having well child checks and all the rest.
Perfect.
So that way, that pediatrician, she can walk the patient and family down to her trusted partner and say, I was just talking to Billy. Billy said he's going through some tough things at school. I wanted to introduce him to you, and maybe you guys can find something that can help. And then the pediatrician can get back to the realities of the healthcare system that they find themselves in.
Yeah.
The family can get help, and the therapist can be a part of a system of care that they feel like what they're doing matters and is helpful. Because that's, part of this burnout problem you hear in healthcare or in mental health care especially, is people sometimes feel like what they're doing doesn't matter, or they're not able to care for the patients in the way that they'd like to.
That's fantastic. And obviously there is the opportunity for some continuation of care with that clinician that is embedded, whether in-house, so to speak, or also referral into the community.
Absolutely. So the current model allows them to go back for several sessions. And if a lot of times that's sufficient and they're kind of back off to the races and on a different trajectory and everything's well and good because we're catching them really early. If, however, they need more services, we have ways of doing that internal to Rady Children's Hospital, our organization, or we have ways to refer out to the community. There's a lot of wonderful, wonderful organizations that are doing great care in our community. And it's really all of us coming together to sort of stitch together a network of care that works for kids and families. But I
Yeah.
think we've been just fortunate for, I think the overall feel of San Diego is one of collaboration.
Mm.
And I think that might be a unique thing to this town.
That's wonderful to hear. As you speak of referring out to the community, again, that village approach, what kind of partnerships are you seeing, or what kind of partnerships are you bringing together to have this maybe more unified approach to address meaningful care?
Yeah. I think we have a number of sort of semi-formalized partnerships with Vista Hill, a great organization here in our community that does mental health care for kids and adults. We have a great collaboration with San Diego Center for Children. They do really wonderful work. Children's Primary Care Medical Group is one of the biggest primary care pediatrics groups in the country. We have very tight collaborations with them. You go back 7 or 8 years and none of those collaborations existed.
Mm.
And now putting those organizations together and saying, hey, this resource exists here, this resource exists there. How do we bring those together so that there can be synergy amongst those different things? And really, the family might not feel like they're being bounced from one organization to the next, but they're really being cared for in a single network. And so I think we're getting closer and closer in that regard.
That's great. That way there is more continuity in terms of how issues are being seen and also how they're being addressed.
Mhm.
Yeah, Doug,
Yeah,
please.
go ahead.
No, I'm aware that you are, making a difference locally, but you're also doing research on a global scale. And I was curious to learn more about the work that's being done, because it sounds like you're trying to get not to address issues once they've already bubbled up, but also at a root level.
Yeah, I think you've probably heard the idea of social determinants of health. I think it's a really nice framework. And so I've started thinking about things of social determinants of mental health as well. And in that framework, a lot of times the social determinants of health would be sort of quoted as 20% of outcomes are determined by access to high quality healthcare,
Mhm.
right? So that's really what most of my career has been focused on, is the access to healthcare, creating clinical programs to help kids that are struggling. Some of the statistics, though, on the rapid rise of psychiatric challenges amongst young people has really kind of spurred me on to thinking about, well, what are the other things that are involved here? And so if you think 20% of the solution is in healthcare, well, what are we doing about the other 80%? And that's usually things like health behaviors, environment, socioeconomic factors. And so those can be really, really difficult to get at. And so I've just been fortunate to partner with a group called Sapien Labs. It's a nonprofit that's really looking at this from a big data perspective. So I'm the only healthcare provider that sort of collaborates with them in as tight of a way as I do. A lot of it is data scientists, health economists,
Mm.
people that know how to manipulate data and set up ways to pull in data. And they've been finding some really interesting things in the global data they have in 70 different countries, 14 different languages, showing the importance of in-person social connection, importance of diet, sleep, mindset, these sorts of things that, really come down to some of the ancient wisdom that I think we've talked about for generations and generations in humanity,
Yeah.
but really putting data behind it.
Mm.
And so that's I think an interesting part of the past few years being involved with that, of thinking, hey, if we really want to find a solution to this, which I think we all do, just walking around town, you can feel that people are worried about this topic. I think that has to be part of the solution. So it's healthcare, data, and research to understand better what's happening with young people. And then it's how do we inspire people to change attitudes and behaviors in the space such that we can get back to a world that young people are really thriving.
That's wonderful to hear. In terms of just how comprehensively you and Rady's and the collaborations that you have are looking at how to make this difference. If someone's listening to our program and they're concerned about their child, how best to access some of the things that you spoke of. You talked about the behavioral healthcare unit. Is that just a walk-in emergency kind of situation? I'm just in terms of continuum of care, how would someone enter in? Obviously, we're talking there's schools that they recognize it, the pediatrician. But if you could just walk around how one could access.
Yeah, I think there's a number of ways in, and it's something that we're happy about. We want it to be there's no wrong door. Yeah, so one place is the behavioral health urgent care. If things are urgent and sort of at a crisis point, we have walk-in availability. People can find that information online. They can call ahead, they can walk in, they can schedule an appointment if they'd like. That's a really great resource. And again, we're really fortunate to have had support from Price Philanthropies to get that started. So that's one way in. Another way in is to talk to your pediatrician. Most of the pediatricians now in San Diego County have been trained in understanding where they can get kids some help.
Yeah.
So a pediatrician is a great resource, and a lot of families know and trust that person. So that's an avenue. The third one is schools. And schools, I think many of them have in-house mental health support, and those that don't know how to refer to appropriate community supports. There's also now the 988, the psychiatric resource line. So I think there's more and more options. And, Rady Children's Hospital is the only children's hospital in town. We've got a 24-hour emergency room. So we're the ultimate safety net that if for whatever reason people are struggling, their kids are struggling, we're here 24 hours a day and people can come in anytime.
I appreciate you providing that array of entry points into seeking care. Could you speak a little bit about the shift that you're hoping to see in terms of how we talk about youth mental health, what the narrative could be?
Yeah, I think for a long time, probably 7, 8 years now, we've been talking about, quote, the youth mental health crisis.
Yep.
And, I think at some point the crisis messaging stops really having the effect that we want it to have. And I think at this point, the message, I think, should be, we know what's happening. We know how to fix it. We know the way forward. We know how to fix healthcare. It's a matter of getting the appropriate people to take those steps and actions in order to allow for things to change. Some of our clinics, some of the clinics, mental health clinics across the country, struggle with the idea that for every hour a therapist or clinician sees a patient, they have to do an hour worth of paperwork or documentation in order to justify the work that they did with that patient. There needs to be reform on the documentation paperwork side of it so that more people can get care and the clinicians can do what they went into the job to do. There needs to be reimbursement for this in a way that these things can be sustainable. I've mentioned many philanthropic supporters of our services because without those, we can't do the work that we're currently doing. So we're fortunate to be on the cutting edge of this, but the only reason we're on the cutting edge of it is because we've had such wonderful philanthropic support. That can change. We can advocate for appropriate reimbursement such that these types of care are standard of care and kids can have it. And then we have to, I think, as a society, think about, well, what do we want for our kids? How do we want them to grow up? Do we want them to grow up in a society and community where they feel lonely and disconnected, which more and more kids do? Or do we value connection, community, support, such that we're going to take action to make sure that that's something that is preserved in our societies? And so I'm hopeful that we can start talking about those things in a way of there are clear solutions to some of the things that are happening, and we can find those solutions and implement those solutions if we value it and take action.
How can I love the vision that you put out there. I was going to ask you at some point, Dr. Maxwell, what your prognosis is in terms of the future of youth that are growing up in our communities. And I love the vision that you've laid out. How can we participate? All of us in community, how do we support the direction that you're speaking of?
Yeah, like so the optimism you talk about it is somewhat because I have a 6-year-old daughter and I'm a inherent optimist. So, I have a little bit of skin in the game to try to make sure that the world she grows up in is a world that's going to be filled with joy and fun and connection and all the things that I've enjoyed in my life.
Sure.
The YMCA, I grew up going to a
Um,
and I think what the YMCA does is a lot of what can be part of this solution. Athletics, exercise, healthy eating, community connection, sense of belonging, a
yes.
place to go when you need some support. It's that type of organization that I think can really organize an individual or a community around these sorts of ideas. But I think it also takes these little subtle things that we all do in our own lives. Of when I drive home tonight and I see my neighbor out walking their dog, do I stop and roll down the window and say hi and ask them about their day? Or do I drive by them 30 miles an hour and not even recognize them? And so I think it is like it takes all of us to create the in-person connection and society that can help support each and every one of our mental health.
Well, thank you for that articulation, and also just how you highlighted the Y's role in your life and hopefully in your daughter's life, and really our investment as an organization in positive youth development. But as you said, it empowers all of us to play a role that can really make that difference.
Right.
My last question, and I appreciate your time today, noting that this podcast is really invested in being well, living well. I give the opportunity to every guest that we have to speak to what in their life is that well-being practice that makes a difference or that's important to them, so that we can learn from each of our guests.
Well, I did not grow up in San Diego, but I now benefit from being so close to the ocean. And 3 to 4 times per week at about 5:30 in the morning, I meet a few friends to surf somewhere in North County, San Diego. And I started doing that on that regular basis during the pandemic. I'd surfed for quite a bit of time, but it was that connection with another person where we were so isolated for that short period of time that I really felt the importance of that. So being out in nature, being physically active, and being with other people and having close relationships, those things really help my wellness and are so invaluable.
That's beautiful. Thank you for sharing that. And we're fortunate that our environment sets up for that very well. But any community, I believe, offers those elements. So thank you for sharing that. Dr. Maxwell, thank you truly for offering your wisdom and really the leadership that you provide in our community and seeking support for our youth mental health and bringing about change in the system so it's meaningful and lasting, so it can provide for that future for all youth like your daughter growing up and being able to thrive. So
thank you for having me, Jonathan. This has been really fun for me.
pleasure. Thank you. And for all of our guests today, until the next time we're together, please be well.